Katie is a care transitions nurse with Heartland Hospice.
I have been doing hospice work for the past 5 years. So I started out as a nurse case manager, having a team of patients that I managed closely and took care of and kind of ran the show, if you will, of our whole team. And then I moved into the care transition nurse role 2 years ago. What it really is it's the philosophy of hospice is comfort-based focused care. It's trying to provide the best care, less invasive, if you can, depending on everybody's situation. But it is a Medicare Part A benefit. We always say it's the best money Medicare can. I mean, it's free to you guys. It's a Medicare benefit. If you're 65 and older, you are it's ready and willing for you to benefit from this if it's something that you need. If you are less than 65, sometimes there is a copay, sometimes they have to pay an X amount until they meet their deductible. So it's not that you have to be 65 or older to get the hospice benefit. I don't want that to be confusing. It's part of the Medicare benefit. So hospice, when you come on, you get a team. When you come on with any hospice, you get a folder, a packet that comes with that lets you know what everything is, and they go through everything. And one of the things that we hand out is, I don't know if you guys can see it good, but it's the hospice care team. You don't have to read it, but just to give you an idea of a visual of all the team members. So first and foremost, you and your loved one run the show. We are here to be an advocate for you, to be support for you. We come in as an additional layer of care and support. So whether your loved one is at home or at a facility or anywhere, we don't change the care that the team is providing in that facility. We just come in as an extra layer of support to kind of help again, guide and be there for your loved one as well as you. You guys run the show. We never do anything without okaying it or talking to the power of attorney or the family, in charge, making sure everybody's okay, including the patient. Everything included in the hospice benefit. The first things I'll kind of run through is equipment. So we cover the cost of equipment that would be considered wheelchair, hospital bed, bedside commode, shower chair, anything that your loved one would need, chair lifts, different things that would help keep them as mobile as possible or whatever their need is. Hospice covers the cost of that. And that can be switched out. There's no limits. It's not like you have one wheelchair for 6 months or anything like that. It can be switched out daily. We have patients where we have to change it daily to get them in a comfortable position. Anything that oxygen, we cover all of that, and we would deliver it to wherever they're at home or at a facility. We also cover supplies. So if you think about anything that you guys use on a regular basis or that your loved one would use in the morning to get up and get going, or activities of daily living throughout the day, lotions, combs, diapers, Depends, wipes, gloves, any type of supplies that that anybody would need, we would cover the cost of, and it would ship directly to the home, to the facility, or we would bring it in ourselves. Also cover medications, and that is any medication that is related to the hospice diagnosis. If I was being honest with you guys, hospice really does a wonderful job of covering all medications except for some vitamins. They can still take the vitamins, they can still take their medications, that any medicine that they want. It's just hospice more focuses on the medications that are trying to help the disease process and trying to slow it down and prevent them from further declining. So anything for pain, breathing, bowels. All you need to get someone initially involved with hospice is you need a name of the patient and where they live. That's all we need. And all you have to do is you would just call and say, I'm interested to see if my loved one is eligible for hospice. And what we do, or what hospice companies should do, is they'll send a nurse out or somebody out to assess the eligibility to see if your loved one meets the criteria for Medicare, for hospice. And a lot of people will, they get caught up on Medicare looks at 6 months or less is kind of what the certification is for hospice. Your loved one has to have a disease that if it ran its natural course, your loved one would pass in 6 months or less. We've had patients on hospice for 2 to 3 years. So that 6-month rule is just if nobody was around to help and support your loved one, give them the medicine and help them eat or provide any kind of care for them, would they make it on their own alone those 6 months? That's kind of an easier way to look at it. It is 100% your choice. You can go with any agency. So I always tell family members, you do not have to go with whatever hospice they tell you have to go with. I am a big believer in patient choice and the fact that you should be able to interview a couple agencies. Every hospice company is slightly different. So we all promote comfort care, comfort-based treatment. But everybody has their little niche or their little specialty. And I wouldn't even look so much online and grade it online. I would actually set up a physical meeting with the companies and do the interview in person. You can tell a lot. I always say like the vibe. You can tell the right vibe by meeting with them. Online or on paper, they could look great or they could look horrible. And then their care could be the total opposite. So they could look terrible online and have the best nurses in that particular agency or area, because not every area is going to have the same, I mean, it's just everybody's different. But I would set up in-person meetings if you can with them, because you can tell a lot by that. You always want to ask the hospice company, what is the on-call and after hours look like for that agency? Because nothing happens on a Monday at 2 p.m. It happens on a Saturday at 3 a.m. Nothing. I mean, it's one of those things where you want to make sure that the odd, weird hours, off times, that when you call that company, because you're relying on them to come out and help you, that they're going to be there, or that, they have staff and all of that. That is my number one thing I tell everybody, to make sure that they ask whenever they're interviewing. So that's where I always say, it's good to have options. It has to be the right fit. The vibe has to be right, but interviewing multiple companies, because some companies will not do feeding tubes, or they won't do chest tubes or active chemo or radiation or blood transfusions or IV fluids. It's a whole big spectrum. But yes, not every company is the same in that way. We really focus on quality. So a lot of people think, okay, great, you can give me the equipment, the supplies, the medications, but why would I need hospice and that support? And that's a great question. And really what it is we encourage patients to come on sooner than later to get all of the extra benefits of hospice. When you come on hospice, you can revoke hospice benefit at any time and always come back on. There's no limit. Once you're on hospice, you're not committed for life or for forever. And there's no limit with coming on and off of hospice. So palliative is, so I always describe it, all of hospice is palliative, but not all palliative is hospice. Palliative is focused on symptom management. Palliative does not mean end of life, where hospice, of course, at some stage in the game, the end of life is, whether it's in 6 months or a year, we can see it's coming. Nothing's, going to prevent that, where palliative is not end of life. And what palliative is designed for is to be an advocate and support, have a nurse practitioner or a physician coming into the home or wherever they are. Palliative is not as comprehensive as hospice, so you do not get all of the support and the benefits as far as the equipment and the supplies and everything like that like hospice would. But palliative, any symptoms that need to be managed, restlessness, anything respiratory, cardiac, pain, any type of symptom that maybe would need to be managed more closely, you would get palliative in there. Difference between hospice and palliative: if someone is on skilled days using their Med A day, their Medicare, and they're on skilled receiving therapy at a nursing facility, they can have palliative and receive that. So it's not as comprehensive. Is really it's kind of something that anybody can be on palliative, and then you can be discharged from palliative. So not all palliative leads to hospice.